Welcome back, dear viewers, and our first guest of the evening is Dr. Ghanem Alsalem, consultant internal medicine and gastroenterology expert. So, doctor, good evening. It's really a pleasure to have you with us on Hala Kuwait.
Thank you very much. Thank you for having me as a guest on this wonderful program who has a very good number of viewers in Kuwait.
Exactly.
It's a very popular show over Kuwait between those who are English speakers, and as you know, we have a lot here in Kuwait, Kuwaitis and non-Kuwaitis involved. And every time I get to be called for this show, I feel pleasured, I feel the happy and the honor to be here again on this TV show. And of course, the first time to be with you, Mr. Mohammed.
It's my pleasure.
And it's really nice to meet all of them.
It's my pleasure, not co-hosting. I thought you were like a TV host with me. MashaAllah. You have this high enthusiasm.
Yeah,
Doctor, it's always a pleasure to have you with us on
Thank you very much.
Hala Kuwait. Dr. Ghanem, as a gastroenterology specialist, will you please tell us what is exactly reflux?
Yeah, that's a very good question. That's a good topic to talk about because in my practice, in our clinic, the most patients we see are the patients who are complaining of reflux. And let's explain this in a very simple terminology for the viewers to understand. Reflux is acid in the wrong place, right? Exactly. Your body is adapted and created where you have the acid inside your stomach. So the stomach is responsible to tolerate, to adapt, to cope with the acid. We need the acid for our digestion. So when we eat the food goes inside your stomach and the stomach starts to digest the food. And we need the acid to break down this kind of materials we are eating through our mouth. Now, when these drops of acids or some amount of acids go somewhere else where they're not supposed to be, that area, which is the esophagus, the link between the mouth and the stomach, is exposed to the acid. These lining inside, or the cells or the tissue, they are not adapted or they cannot tolerate the acid. And the acid starts to break them down. So they break the cells, break the tissue, break the surface, and then the patient will have these symptoms. So reflux in brief is the acid go somewhere else it's not supposed to go, and mainly goes up inside your esophagus, giving the patient these symptoms. The symptoms the patient will complain of a lot of things. For example, patient will come with the mild symptoms. Some patients come with a complicated reflux disease. And for example, most people will know that the heartburn is the main symptoms. The patient will feel some burning sensation in their chest. They cannot sometimes tolerate food or water. When they drink, they feel some pain in their esophagus. Sometimes the patient will develop what we call dyspepsia, difficulty to digest the food. Sometimes they wake up from sleep from that pain. Some of the patients, they may have actually vomiting. They may have nausea. Some of them, they may have a blood inside their vomit. And that is the complication side of the reflux disease.
Definitely. So, doctor, I can imagine our viewers watching us tonight, especially the people who like to eat late and eat heavy food late, are worrying about the next question, like the cause of reflux. What is the cause? Is it the cause related also to eating heavy food at night? Yeah,
that's a good question. Yes, we see that the patients, they have multiple factors to cause the reflux, and sometimes that's our job to do when we interview the patient the first time when they have reflux disease. We try to see why they have a reflux. So we divide these patients in multiple categories. For example, sometimes the patient may have congenital anomalies. That means the reflux, the gate between the esophagus and the stomach is disturbed because of something mechanical outside the hand of the patient. So we need to correct that, or may need surgery to correct that. Sometimes the patients, they have what we call obesity. So they're increase in their size in the abdomen, the pressure inside, and cause the reflux to go up. But the majority of the patients, they have what we call a lifestyle bad habits, all right? So they have to eat late at night. Sometimes they eat the wrong food, lack of exercise, and the most important thing and worrying one is the bad habits like smoking.
Exactly.
Now, you know, the whole world is celebrating the World Cup, right? Definitely. Everybody is watching the World Cup. They like to have snacks with the World Cup when they watch the game. Now, sometimes these games come late at night, or if you have to watch a movie at night and you eat something, usually this kind of habit of eating cause the reflux to the patients. And the most important thing, we are in the winter time. The nightlife is great during winter time, and what is best to have at night is heavy food.
Exactly.
Heavy food, heavy...
Especially with the cold weather.
With the cold weather, fatty food, a lot of oil in the food, and it causes the reflux disease.
Exactly. And you mentioned, doctor, like sometimes people when they are watching a film at cinema or at home, watching a football game or anything that's interesting and tracks them on TV, sometimes they're not aware of what they're eating and the amount of food or snacks they're eating. So some people believe like they eat heavy at night, they wake up with, let's say sometimes they wake up thirsty or might be, reflux might be
the cause.
But they're not aware of the risk factors. Sometimes they say, we just did that last night, or we only do it during the weekend. So will you please tell us more about the risk factors?
Yes. So the main risk factors for those patients, we think there is having any bad habits like smoking, patients who are under stress, those who have actually take medication for something else, like the patient sometimes be on steroids for longer time, patients will be on painkillers for longer time, patients who are obese, patients who are having to stay late at night, they don't sleep enough during nighttime. You have to understand that staying awake for overnight and most of your sleep during the day is not good for your system. It's not good for your brain, not good for your digestive system. There will always be disturbance. There will always be disturbed, and you don't have enough time. You don't give enough time to the system to recap and recover. So these are the main risk factors. Also, I have to add those who are under stress jobs, like doctors, nurses, people who work in the firefighters, people who work their job required to have night shifts. Those are the main risk factors for patients to have a reflux.
Definitely. So, doctors, still like we are wondering about the food. Let's go back to the food. So, what type of food that might cause reflux, and what type of food it's okay to eat, like, and not worry about reflux, especially when it comes to winter evenings and movie nights and going to cinema or watching a football game?
Yeah, that's a good question, and that's the main point of having this interview. I mean, this is the job of the media, and I'm very happy that you present this to the media so the viewers will understand. You know, we're not here to teach them what to eat. They know what to eat, but we are trying to guide them to the best healthy diet they can adapt. You have to understand that it's different from patient to patient, from individual to individual. In general, that science tries to prove which kind of food they should avoid during reflux or to prevent the happening of reflux. So there are a lot of debate in our field which food we should prevent the patient from taking or prevent the individual from taking, and which food will encourage them to take. But in general, I always advise my patient to do a food diary. Sometimes what you eat is good for you, but with the same food somebody else will eat will develop the reflux. So I tell the patients to have a food diary. They write down what they had when they develop the symptoms. They just write down a note of what they have eaten, and then with time they will understand what food they can avoid. But in general, let's say in general, we don't advise them to take fatty food full with oil. And sometimes the other patient was asking me about the olive oil. I said it's the same. The olive oil also is a kind of oil, is a kind of fat, so you really need to step down with the olive oil. Olive oil is healthy, but is not too much, because anything you take too much will be not good. So even the olive oil is treated as a fatty food. The other thing is fast food. You know, we don't advise you to take fast food. Fast food is full of food is junk food, we call it. It's not good for your digestive system, and the stomach tries to digest that food with producing a lot of acid. The other thing is things with spices. Sometimes they can cause the acid reflux disease. The other thing is we ask them to stop or slow down from taking a lot of sweets. Sometimes the sweets actually produce a lot of acid inside the stomach, and they can cause the acid reflux disease. Eating at night before you go to bed, we always advise to keep 3 to 4 hours time where you give the time for your stomach to digest the food before you go to bed, because lying down after having a heavy meal or kind of meal will make the acid a lot, and the acid start to migrate from the stomach up inside your esophagus, and then you will have these symptoms. Patients sometimes, you know what, they wake up in the morning and they say, I have cough. And they go to a respiratory specialist or the chest doctor, and they don't have anything in their chest. It's just the reflux causing them to cough. Sometimes patients will have their voice will start to weaken, or they have hoarseness of voice, and they think they go to their ENT specialist, ear, nose and throat specialist, and then they will tell them you have a reflux disease. So sometimes the reflux is a silent. You don't have the typical symptoms of heartburn or fullness, but you will have other extra manifestation outside your stomach, like your voice or your cough, or sometimes you have sinusitis. These are also because of your bad habit of food, or taking the food especially late at night. So the best advice I can give them is to watch your food, take the right food at the right time, and give time to your stomach to start to digest it to the best it can before it starts to produce a lot of acid and goes to reflux.
Well said, Dr. Ghanem, and we still want more information from you.
Sure.
The next question will be about like a certain lifestyle, or what kind of lifestyle we can follow, and what type of diet you recommend we follow to avoid having reflux, or get rid of reflux also.
Yeah, that's an important thing I need everybody to pay attention to. We can give you medication, but if you don't change your lifestyle, we cannot help you. So the main treatment of reflux disease is your lifestyle. I always sit down with my patient and tell them education. When you understand the disease, you understand what is going on and how it's been done, then you can manage and you can control the symptoms.
Definitely.
So the first thing, we always ask the patient to start to have some sort of exercise. If you walk every day, that will be good. If you have any kind of sport daily basis, that will be very good. Half an hour, 1 hour, that is very good. You can take any kind of exercise, swimming, playing soccer, walking around, but at least you have some activity. Physical activity is very important, and you don't have to do it every day, but you need to do it most of the week days.
Exactly.
So you can do it 5 times a week, and you take 2 days rest, but at least you make your body physically active. That's the most important thing. The other one is you stop the bad habits. If you smoke, you should stop smoking immediately, because smoking is the big risk factor for having these symptoms. Third is your sleeping habit. As we said, you need to give time before the last meal and before you go to bed. And one more small tip advice here. Before you go to bed, don't drink water. If you want to drink water, just drink it earlier. So don't drink immediately before you go to bed, because water can make also reflux disease if you drink water at the last thing before you go to bed. So try to avoid water as much as you can before you go to bed. Number 3 is the eating habit. We always tell the patient, eat what is enough for you. You don't have to make your stomach full, because if you fill up the stomach, there's no space for the acid except going up inside your esophagus. So try to eat what you need only. Try to select the best food you can where you need that food. Fruit and vegetables will slow down the acid. If you take home cooked food, better than taken from restaurants. Try to avoid fast food. Try to avoid this too much spicy foods. Try to avoid the food with full of fat, fatty food. Try to avoid the food with a lot of additives. Try to make it, more natural, organic food. That will reduce your acid reflux. And finally, as I said, you always need to do the food diary with you, and that will help you a lot to get rid of these symptoms.
Definitely, doctor. So when it comes to reflux, is it safe to say that reflux can stop or disappear and then it comes back to the patient?
Yes, that's true, absolutely true. So we see the patient in the clinic, we give them this conversation and this consultation, they go happy 1 month, 2 months, and they come back with the bad habit, and the reflux will come back again. As long as you don't change your lifestyle, these symptoms will come back. As long as you don't change your bad behavior, habits of smoking, these reflux will come back. So reflux is very disturbing disease. It gives the quality of life is less. So if you have this burning sensation all the time, you cannot communicate, you cannot socialize, you cannot do your work in the right place. All with patients, they feel this, they want to get rid of these symptoms. They are not nice symptoms at all. Exactly. And the best way to get rid of these symptoms is to adapt a healthy lifestyle. See, I'm saying lifestyle multiple times, and I have to focus on the lifestyle because it's the main thing. We don't want you to be on medication for the rest of your life. You need you to be healthy as much as we can, and that's our mission, that's our job as doctors. The other thing is, you have to understand, if you have reflux for longer time, without breaking down these symptoms, you may develop complication of the reflux, and we don't want that to happen. And the most important one is the Barrett's, the condition we call Barrett disease. Barrett's, from the acid you are having inside your esophagus, the esophagus starts to adapt to this acid. So it starts to change the cells lining of the esophagus. These cells, they are the esophageal cells. They start to be like a gastric stomach cells. This change happens at the DNA level. So if that happens, this is a precancerous condition. And this is very dangerous to have. So all the patients who have this reflux disease, we need to advise them to adapt to new lifestyle, take the medication, and these symptoms should go away. If they have this chronic ongoing symptoms, ongoing acid in their esophagus, the risk of having Barrett's increases. And if the Barrett's happens, the risk of having cancer in the esophagus increases. So we need to sit down and tell the patient, we don't want them to be scared, but we want them to be more cautious of the symptoms. We want them to be more, aware of the symptoms, and they want them to be more having good life without these symptoms and without these complications.
Well, Dr. Ghanem, we've learned a lot from this interview, actually. You had a lot of valuable information you just shared with us, but we want one last advice from you, please.
Okay. First, we wish all the best for the World Cup soccer teams, and I hope that everybody have to enjoy what Qatar is doing. We are so proud of what's happening in the Gulf, and we are in support of Qatar team and the Qatar people and the Qatar government, mashallah, and we hope for the best for them. And I advise everybody to watch the game and enjoy it with a healthy lifestyle, healthy food, and get physical, start to change your life.
Well, thank you so much, Dr. Ghanem, for being tonight with us on Hala Kuwait. It's a pleasure to have you with us, and we wish you the best of luck with your future endeavors. Hope to see you soon.
Thank you for having me. Thank you.
Thank you. It's a real pleasure. The viewers, we just had with us Dr. Ghanem Alsalem, consultant internal medicine and gastroenterology specialist. Let's go now check our next report. Let's have a look at it, and we'll be right back. Stay tuned.